Hello, Unit. Welcome to India to our Center for Life Sciences, Health and Medicine.
Thank you.
He's Dr. Hewlett Smith. He's very happy. He's coming every 2 years to visit India, and he helps our children as well as he helps our other children from the USA, as well as your daughter has been helped very well by G therapy in last few years.
Correct.
And she has almost become near normal now. So, Unit, what is your experience about G therapy?
So my name is Hewlett Smith. I'm an occupational therapist from Georgia, near Atlanta, Georgia. And I've been engaged in occupational therapy practice for the last 20 years. My wife is a physical therapist, and we have operated an integrative practice for about 20 years now, providing rehabilitation services primarily to children. I'm also the CEO and co-founder of a company called RehabMart.com. And we are one of the country's largest distributors of rehabilitation products and equipment online. Now we're also a government contractor, and we distribute and sell on the GSA schedule to the Veterans Administration and to other governmental agencies. I first came to know about G therapy in 2002. I learned about it a little bit earlier, but my daughter was born in 2002, my first daughter. And she had a bleed in utero prior to birth and was diagnosed with an intraventricular hemorrhage and also with hydrocephaly. So she was shunted at, I believe, around 16 days of age. And immediately, as soon as we learned about the diagnosis prior to birth, we learned about her diagnosis via ultrasound. And my wife and I immediately started planning Sophia's integrative treatment plan. And so within that first year, we observed some of Dr. Oswal's work online, and I was immediately intrigued and wanted to learn more. And around 2004, I traveled to Pune at the invitation of Dr. Oswal, and I spent more than a week learning and being with him, studying with him, and he became a sort of mentor to me. Also, when I went back, Sophia started on G therapy, and her prognosis was moderate, was fairly moderate to severe, depending on the neurosurgeon or the neurologist or the developmental pediatrician we were speaking with. But she had a significant amount of brain damage from the bleed. She had hydrocephalus. She had cortical vision impairment with an MRI showing that she had profound damage to her primary visual cortex. So she was diagnosed as being legally blind. She had strabismus and nystagmus, with her eyes moving up and down almost constantly. Her eyes did not respond to the light reflex initially. So we bought a hyperbaric chamber in that first year of her life back in 2002, and we started doing our own hyperbaric oxygen treatments along with other integrative approach, a brain food diet, breast milk, omega-3s with high levels of EPA, DHA, and then in 2004 we started G therapy. Within that first year of her, within the first month actually of her starting G therapy, she was creeping around, crawling around. We were doing a huge floor program, but within the first months of G therapy she started popping up off the floor, pulling to stand. And we have some videos of Sophia now. She's 12 years old. This is November of 2014, and Sophia is actually 12 and a half years old. She's very articulate. She's in 6th grade, normal education classes, and she's doing well in school overall. She struggles with math and has to do some extra tutoring in certain subjects, but she's really doing amazing. We saw the biggest results in with the first time that she took the therapy. We saw a softening in tone, reduced overall spasticity, improved overall motor planning. We have a lot of video that documents this, and Sophia also is very articulate and kind of can share her own experiences regarding taking G therapy over the years. I've continued to come back every couple years since 2004. Right now it's 2014, and every time I come, I just gain greater insight, a greater depth of knowledge concerning Dr. Oswal's work, and also just the total integrative approach that he's fostering here at his center, the Center for Life Sciences here in Pune, India.